And of course, staying on the news at this time, the arrival of a new baby is an exciting period for most families. For mothers, a safe delivery is what matters the most. However, for some mothers, the birth of a new baby can also lead to sometimes unexpected postpartum depression, popularly known as PPD. Now, the World Health Organization says about 20% of women may develop PPD, a problem that is little talked about in Nigeria. Yet, a problem that quality postpartum care is not readily available within the country and many places across Africa. And of course, to speak more on this is consultant gynecologist and obstetrician, Dr. Tope Akinola, joining me on the news. Thank you so much for your time, Dr. Akinola.
Good evening. It's a pleasure to be on New Central TV.
It's a pleasure having you too. Now, firstly, are there any direct causes of PPD? And are there any factors that can contribute to a woman experiencing PPD during pregnancy or after delivery?
Yeah, so there are no single direct causes of postpartum depression, but there are things you can call risk factors, things that increases the risk. One of them is genetics. If there's a family history of postpartum depression, the risk is increased. If the patient has had an history of postpartum depression from a previous delivery, the risk is increased by 30%. There are other social factors that can increase the risk of postpartum depression. If there's marital conflict in that relationship, if there's poor social support, there are no support system for the new couple. New couples, first-time partners or first-time mothers are at increased risk of having postpartum depression. And this is also not exhaustive. This also involves even surrogates and even people who adopt can also suffer postpartum depression. So weak support system, financial system, poor this thing. Also hormonal changes. The drop in estrogen and progesterone levels that drops post-delivery has been found to be a contributing factor to postpartum depression. So you talk about risk factors, not as if there's a single direct cause of postpartum depression. And it will happen in like 1 in 7 deliveries, like 15%. That's postpartum depression.
All right, great. Let's talk about the major signs a woman or her family should be looking out for to know if she's actually suffering from a PPD, and also the treatment. What are the treatments available for women going through this particular phase?
Okay, for the symptoms, for the patient with postpartum depression, you might notice things like frequent crying episodes, loss of appetite, you may lose loss of interest in things that the patient used to take interest in even before pregnancy. So there's loss of interest, frequent crying episodes, feeling of shame, feeling of guilt, feeling of not bonding with the baby. Now, I must say that there's a thin line between what we know as postpartum blues and postpartum depression, because both of them are still under what we call postpartum mood disorders. So some of those symptoms may extrapolate to the other one. But the difference is that in postpartum depression usually may last longer. In postpartum blues, it may start 2 to 3 days after delivery, and usually within 2 weeks it's gone, and the symptoms are milder. But the patient with postpartum depression, the symptoms are more intense and can last for several months, even up to a year. So frequent crying, frequent loss of interest, not bonding with the baby, feeling of guilt, feeling of shame, and things like that, not bonding with the baby. And in the severe cases, some of them may start having feeling of harm and all that, for the baby. Now, it's important for the patient to know, a patient with postpartum depression, and for people around to help them to seek help. Let them know that it is not due to any particular thing they've done. It's not due to their fault. It's not as if they're a bad person. It's just a mental disorder that requires co-management with a psychologist, a mental health physician, and your obstetrician. So as per treatment, the medications play a role. Sometimes they benefit from antidepressants like sertraline and fluoxetine, which will be administered by the psychiatrist or the mental health physician. And they should note that for the medications, there's a way it must be given. They mustn't use for a short period, because if you use for a duration shorter than when you're meant to actually use it, it can make your symptom to come back. And usually we normally reduce the dose slightly before stopping it, okay? So medications play a role, and most of them are safe for breastfeeding mothers, because I know that that would be a concern that, oh, can I take such if breastfeeding? But it must be prescribed by your mental health physician after you've been evaluated. Some will also the role of psychotherapy plays a role. Talking to someone, having physical therapy, or what we call cognitive behavior therapy. And some of them do well by also joining support groups. There are WhatsApp fora and support groups of newly or first-time mothers expressing their concerns, having like a group therapy, focus group discussions to talk out and express their concerns will help a lot of them to actually reintegrate and understand what this condition is about. I must also say that if you notice any of these symptoms in a woman who has just delivered, you can help them by also trying to help out with chores, allowing that they sleep when the baby is sleeping, trying to identify things that would make them not to be overwhelmed so that they can get out.
Being more like a supportive partner during that process. Being a support.
I wanted to mention that even the partner, the male partner of a woman who has delivered can also suffer from postpartum depression.
I was about going there because it seems most of the time this conversation just tilts towards the female partner. But there have been cases too of men who, after childbirth, were afraid to touch their newborn babies. Some of them even run away. Some get drunk, some get missing for days and then come back quickly. Before I let you go, for the male agenda or the male aspect, what can be done? I mean, what are those signs also that exhibit in the male aspect too that should be looked out for, and how can it be managed?
Low mood, low energy, loss of interest in the things you normally take pleasure in. You get withdrawn. Some feel worthless. Why did I put this woman this way? And they're not connecting with the baby. Normally, you expect a recently delivered mother or the partner to be joyous and to be very excited about the newborn baby. But you might just notice low mood. You may just notice that they feel overwhelmed, they feel tired, loss of interest, and things like this. So it's about offering support to them, because sometimes if you don't offer the support, postpartum depression can move from mild to moderate to severe postpartum depression. And you can have a severe form of postpartum mood disorder known as postpartum psychosis, which is actually a more severe form where there's things like hallucination and delusion, is hearing voices that other people are not hearing, and some that gets to, and further that can end with suicidal ideation or the thought of harming the baby. So we should recognize these symptoms as early as possible so that it does not progress to the level of postpartum psychosis.
All right, thank you so much for your time, Dr. Akinola. Thank you once again.
It's a pleasure.